Right now, lawmakers and town officials in Ayer are gathering, trying to push back on the closure of Nashoba Valley Medical Center. Let's listen in.
We have legislators, we have municipal officials, we have public safety officials, we have union leaders, nurses, doctors, patients, community leaders throughout the Nashoba Valley, throughout this north central here. And I want to thank you from the bottom of my heart for being here and sending a message not only to Steward Health for their greed, for their corruption, for their practices that have led us to this very troubling situation, but also to asking the Healy-Driscoll administration to take every possible measure to make sure health care is provided in this region and we stop the closure of the Nashoba Valley Medical Center. So, we all know about the practices of Steward Health, their mismanagement, the corruption, the fraud that's been committed by Steward Health, and again, this is the major reason why we're here today. And I want to thank all of the stakeholders for doing their work, including the Healy-Driscoll administration, to make efforts to what can we do to make sure that we provide great quality health care across Massachusetts, including all of the Steward hospitals, including the Nashoba Valley Medical Center. But I want to condemn the practices of Steward. I want to lift up the fact that we have a broken healthcare system, which very sadly and despicably Steward Healthcare has taken advantage of. But I also want to lift up that there is still more to be done at the state level. There is still action that we can take. And so what I first want to say is, given the potential closure of the Nashoba Valley Medical Center, I want to call on Governor Healy to enforce the 120-day Department of Public Health regulation that there are 120 days before any medical facility can close in Massachusetts. Governor Healy needs to issue this statement today. Will you support me asking Governor Healy to take this action? Now, since so many of us received calls on Friday about the bankruptcy filing of Steward in a Texas court, we have also heard follow-up from doctors at the Nashoba Valley Medical Center, from public safety officials, from government officials, that there are there are serious interests of bids from other hospital networks, from other potential buyers for the Nashoba Valley Medical Center. These are nothing that is specific, nothing that is public right now, but what we do know is that there have been conversations about the possibility of finding a buyer to protect and keep Nashoba Valley Medical Center open. So I am urging Governor Healy and all public health and healthcare stakeholders to do everything possible to do this outreach and to make sure that if there are realistic buyers, if there are serious networks that are interested to purchase the Nashoba Valley Medical Center, that those go through so we keep Nashoba Valley Medical Center open. It was said by so many Massachusetts elected officials, healthcare leaders, public safety officials, nurses, doctors, dedicated hospital staff, is this is Massachusetts, right? We provide the best quality health care in the country, right? And the Nashoba Valley Medical Center is renowned for the quality, community-based, excellent health care it's provided patients and residents across the Nashoba Valley since 1964. So we're used to taking on tough challenges and finding solutions when we're in a difficult situation. That's what Massachusetts is known for. That's what Massachusetts elected officials, including myself, are committed to. So what I want to say to the Healy-Driscoll administration, we're not going to give up. We're not going to give up. We're going to keep fighting. We're going to keep fighting not only to prevent the closure of the Nashoba Valley Medical Center, but also to maintain the quality of health care in this region, which is critical to every single resident in this region. And so please join me in calling on the Healy-Driscoll administration to continue the quality of health care and don't give up. Keep fighting to keep Nashoba Valley Medical Center open. reflection of the support we have, not only in this community across the state, as we have a number of elected officials, union leaders, healthcare leaders, elected officials who also want to share some comments with me. But I just want to close before I introduce one of my colleagues is that, I've represented the Nashoba Valley for 22 years. I was a state representative for 6 years. I've been a state senator for 16 years. Represented the Ayer-Shirley area, again, for over 2 decades. And one of my memories I was thinking about this week, after we heard the news about what might happen with the Steward proposed closure of the Nashoba Valley Medical Center, is a constituent of mine, former constituent of mine from Shirley. Her name was Phyllis, and she was a very hardworking person, but someone who had a very difficult time in her life, a lot of struggles. She lived in one of the mobile homes in Shirley, and because of the fact that I was going door to door and meeting voters, I happened to meet her, and we struck up a friendship. And then sadly, throughout most of Phyllis's life, she was very alone in her life, she was very isolated, but the one lifeline she had throughout the last 25 years of her life is the Nashoba Valley Medical Center was always there to provide care for her. They were always there so she could see her doctors. When she had an emergency, she could go to the emergency room at Nashoba Valley Medical Center. And yes, very, very sadly, when she passed away, she went to Nashoba Valley Medical Center to take the best possible care for her hospice care. And what I remember again is that when she was alone, when she was isolated, when she didn't have the support, she could rely on the Nashoba Valley Medical Center. And I know so many people here have done that work, nurses and doctors. So many people here who are patients have received that quality health care. Residents care deeply about having a hospital nearby if there's a medical emergency, or to see their doctors regularly, or to go and check in on their nutrition or public health or other needs. So that's what we're here for today. That's what we're looking here to protect. And again, from the bottom of my heart, thank you so much for being here. Keep fighting. And now I want to introduce my colleague and the state representative for Ayer, Representative Danilo Sena.
Well, hello everyone. Thank you, Senator Eldridge, for your words and your advocacy on this matter. I wish I was here today with good news, but today we're here together to prevent this hospital from shutting down. Since the news of the Nashoba Valley Medical Center closing broke on Friday, I have received dozens of emails and phone calls from constituents, and I'm sure other legislators here standing here today can attest to this as well. The message from all of us has been very clear. Nashoba Valley is essential in our region, and shutting it down with only 30 days notice is unacceptable. What we are seeing playing out in front of us is a result of years of poor management by the higher ups at Steward. What we're seeing is a result of prioritizing profits over people, prioritizing money over care, and prioritizing greed over the needs of our community. Nashoba Valley, our community, will be forced to travel far distance for care. In an emergency, every minute is crucial. Constituents came to me with stories of patients at Nashoba Valley who lived because they received care just at the right time. If these patients were pushed to another facility, they might not have survived. This decision also places the jobs of hundreds in jeopardy. I received an email yesterday from a doctor who ran his practice of Nashoba Valley for almost 30 years. While he disagreed with the for-profit model for Steward, he took pride in providing care for his community. Now, he may have to move in less than 30 days in an impossible mission, and this completely blindsided him. Hundreds of nurses, doctors, professionals deserve answers, and they deserve to keep their jobs. I stand here or we stand here today to make one thing clear, unequivocally clear. We must demand that Governor Healy takes action to secure our access to health care. We must require Steward to follow the law, requiring 120 days notice, and we must uphold and we must uphold the Steward's officials accountable for their actions. With that, I want to say thank you, Senator Eldridge. Thank you, everyone, for coming here today.
Thank you so much, Representative Sina. Honored to stand here with you. I now want to ask someone who has an extremely strong partner throughout her first term as state representative and was one of the first legislators to call me after Friday's news, Representative Margaret Scarsdale from Pepperell.
Good morning, everyone. It is an honor to stand here with you, and I will say at the outset, I think you are going to hear some recurrent themes throughout all of these, the conversations. Make no mistake, we are here today because of callous corporate greed on the part of Steward Healthcare System. And it is a horrible reminder of what happens when profit is put before people's health and is put before people's lives. Steward Hospital's decision to close Nashoba Valley Medical Center is abhorrent, and it shows an utter lack of regard for the safety and the well-being of our area. Our first responders have repeatedly warned that lives will be lost without this emergency room. And those warnings have been ignored by Steward. So while Ralph De La Torre lounges on one of his yachts, our residents will be paying the cost for this. Shame on Steward. Shame on Ralph De La Torre. Shame on a healthcare system that puts profit above people. We are also here today to stand alongside the hard-working medical professionals who have fought valiantly to keep this hospital running in spite of Steward's negligence. We're here for our dedicated first responders who know the crushing impact this closure is going to have on our 911 emergency medical services. As the fire chief in my hometown, Pepperell, Brian Borneman, put it, quote, "The domino effect of Nashoba closing, especially in this unique geographical area, with increased transport times, longer turnaround, and wait time at other hospitals, will have a direct and negative impact on patient outcomes in all of the area towns." Most of all, I think we can agree we are all here today for the patients and the people who rely on this hospital for not only emergent care, but routine care. My constituents have been reaching out to me since Friday, and they tell me stories of lives saved at this ER, including a mother who wrote to me yesterday from the ER while her 5-month-old son was being treated. He had been whisked from their home and brought to the emergency room because he was turning blue. This hospital is truly a lifeline. Another constituent wrote and said, quote, "We have created crisis after crisis in healthcare by following financial gain and forgetting that people needing care could be us, our parents, our grandparents, our children, our partners. We need health care. We need mental health care, and we need access to more of it, not less. The news of this proposed closure by Nashoba Valley Medical Center is not the end of our fight to rid our Commonwealth of the shameful corruption of Steward Health. It is not the end of our fight to ensure healthcare professionals receive the working conditions and benefits they so richly deserve. And it is certainly not the end of our fight to guarantee that every patient has access to high-quality health care. They are entitled to it. Health care is a right. Our community has come together in opposition to this closure. We will continue to stand together as we determine the path forward, and I am honored to stand with you and my colleagues. Thank you.
Thank you so much, Representative. We're here at Ayer Town Hall, and I want to express my deep gratitude to Ayer Assistant Town Manager Carly Antonellis, all of the staff at Ayer Town Hall, and Robert Pontbrand, the Town Manager, who has a statement to make. I do want to make a note because we're here not only with elected officials in this region, but union leaders that represent unions that also have many members at Kearney Hospital in Dorchester, is that we're also standing here in opposition to the closure of Kearney Hospital in Dorchester. And I want to thank my colleague, Senator Nick Collins, who the two of us have partnered in these efforts for the past several days. But now I'd like to have Ayer Town Manager Robert Pontbrand give a statement.
Thank you, and good morning, and welcome to the town of Ayer. And thank you, Senator Eldridge, for putting this together. And I think one of our next steps from here is that closure is not a viable option for the Nashoba. The stakes are too high, and we are on a critical threshold where anything shy of staying open is just not acceptable. And speaking from the local level, first of all, I'm very pleased to have so many local colleagues here in support. Mayor Mazzarella from Leominster, Mayor Squalia from Fitchburg. I see members of the Board of Selectmen from Groton, the town administrator from Pepperell, and all of you from our 17 towns in the Nashoba Valley. This hospital is a critical public health facility that fills a key void. If it's closed, you're looking at response times increasing, in Ayer's case, from 10 to 15 minutes to over an hour. It's not acceptable. There is no healthcare facility like Nashoba in the Nashoba Valley. You have facilities to the east and to the west and to the south, but this is a critical public health facility in the town of Ayer. Additionally, it is one of our largest employers. There's over 500 jobs up there, and I see many of our nurses here today, many of our support staff up at the hospital. These jobs are vital to the families of the Nashoba Valley, and we have to protect those. There's also one of the... To echo what the senator and others said, we are calling on the local level, we are calling on the governor to make this a priority, that we are going to need state financial assistance to make this happen, and it has to happen. I see over here a nurse has a sign that says 30 minutes is 25 too long for life or death. That is the truth. If this facility... If this facility closes, I can assure you that all of our emergency response people will continue to provide the highest quality of care that they do. However, the challenge is going to be the distance and the time it takes to get to Emerson, or to get to UMass Leominster, or to get to Worcester. This length of time will become a reality and will be a matter of life and death, and that's what makes this critical. So to conclude, what is our plan moving forward? So on behalf of the Ayer Select Board, and Selectman Chris Tavares is here, I know Selectman Janice Livingston is here, Selectman Sean Copeland, what is our local plan moving forward? First of all, we're with you 100%. You know that as far as the support. Secondly, we must continue to contact the governor and local leaders and continue to keep that pressure on. Third, I know that the leadership at Nashoba is actively working to secure a bid. That is key. We need an operator that's qualified to run the hospital and get underway. When we get that bid, then the state delegation and our federal leadership, we need to step in and with the governor get some financial support from the state to make this happen. No different than the 5 that are being helped. We want to be the 6th, and we want Kearney to also be in there, number 7, and move forward with a plan. So with that, I'm going to turn it back to the senator. The town of Ayer is with all of you 100%. My assistant, town manager Carly Antonellis, who met with the DPH commissioner yesterday. I also want to thank Chuck Schultz, our facilities director, for putting this all together on the fly, as they say. Closure is not an option. Thank you.
Thank you so much, Robert. We have elected officials from outside directly the town of Ayer, and I want to say, the North Central Mass region, this is not the first hit on healthcare we've had over the past 2 years. Most recently had the closure of the maternity ward at the Leominster Hospital. Following that, and is deeply dedicated to healthcare access.
As the senator said, first time. It's not my first time facing one of these closures, and I am here to stand in solidarity. I'm so glad to see Mayor Mazzarella and Mayor Squalia here from the Twin Cities to say, right, this is going to impact the entire North Central region. And I don't know about you, for my community, when we were facing the closure of our birthing center, the question that I'm getting asked was, how can we close something that the Department of Public Health calls essential to the community? My read on it is that the Department of Public Health has a whole lot more tools than they're willing to actually use, but if they really do not believe that they have the tools, let's give it to them. And that's why I teamed up with so many of the members of the North Central Mass delegation to file a new bill that would preserve essential services. If the Department of Public Health holds a hearing and deems the services of the community, they got to keep them. The hospital has to figure it out because they are community and our health and safety. And so I am here ready to fight with these amazing colleagues behind me to keep this hospital, because the ripple effect of this will impact the entire country. And this is not the Massachusetts that I'm so proud to have grown up in. We have some of the best healthcare in the world. For too many of our community members, they do not have access to it because we continue to allow hospital executives to shut them down. It's not acceptable, and we need to stand up to it. So thank you so much.
Thank you so much, Representative Higgins. Thank you so much for being here. Other municipal officials, I know Mayor Mazzarella is here. I want to introduce Mayor Sam Squalia, the Mayor of Fitchburg, for her perspective. Madam Mayor.
Thank you, everyone, for coming here today. This is a great turnout and show of solidarity. When are we going to realize that our for-profit-driven healthcare system is killing us? It's hurting our most vulnerable people. In Fitchburg, we have a high percentage of our community that is low income, are not able to drive long distances. They shut down Burbank Hospital in Fitchburg slowly Like Representative Higgins said, death by 1,000 cuts. They did that in Fitchburg at Burbank Hospital, and they would close things slowly, and they'd say, it's okay, for this service, you can go to Lebanon. For this service, you can go to Nashoba. For this service, you can go to Gardner. And then slowly but surely, they gutted us until it was gone, until they shut it down completely. Then in Leominster, they keep gutting services until they finally closed the maternity ward in Leominster. So now what? We have to go to Gardner, we have to go, which they tried to close, which they threatened bankruptcy in Gardner. You have to go to Emerson Hospital in Concord. You have to go to Clinton, UMass Memorial Clinton Hospital. And so the closure of Nashoba Valley is going to have ripple effects. It had ripple effects in Burbank, Fitchburg, ripple effects in the area when that closed. Now the maternity in Leominster. When this closes, it's just to overwhelm hospitals until what? They close one by one. This has got to stop. We've got to stop this. In Massachusetts, we are innovators. We have it all here in Massachusetts. We are supposed to be the best healthcare in the world. We are supposed to be the best. Our state has to figure it out. And the federal government has to overhaul our healthcare system. Thank you.
Thank you so much, Mary Squire. Really appreciate you being here. We also have. Can I just say something? Oh, I'm sorry, Mayor Mazzarella. Forgive me.
I'm screaming loud because everybody wanted to see this today. But look. You got to support these people. They're out here fighting for you. They're going to not sleep until this is over. A couple things. You need to raise some money. They're in bankruptcy court. You need an attorney. They're in bankruptcy court. You need to have your own study. No offense. Not a state study. I've lived this. We've studied this for over a year now. The whole area, not just Leominster. This can't happen. Your EMS system can't handle it. They're already getting mutual aid. We're borrowing from each other during the day on 911 calls that are life and death, and we can't get to them. We're calling Sterling and other towns. They can't do it. Trust me. We've studied this. We've studied this over and over. Can't do it. You need to raise some money. You need to raise some money. You need an attorney in that bankruptcy court. You need an attorney to fight this thing, and you need to have your own study done because, trust me, your study is going to look a lot different than the state study. So. I don't know how you're going to do this. We did it. We spent hundreds of thousands of dollars to fight it. You got to start today and keep up this effort. Keep the pressure on it. This is what works. But at the same time, you need to start today to raise some money, whether it's from the unions, from the federal government, businesses, unions, whoever it might be. You need to have an appearance. Everywhere they go, you need to go. And you need your own study. Hang in there. Fight until the end, till the absolute end. Just keep fighting. Don't give up. Trust me. Don't give up. People want this hospital. People want the service that the nurses and the doctors give them. This is not something like closing a little, paper stuff. This is big. This is bigger than big. Every last inch of breath, you have to continue on with this because it's going to make a difference. You are the people. You will make the difference. You have the hospital open. You have to. It's not just any hospital. This is a really special hospital here. I've never heard from so many people with stories about this hospital and the care that they get there. It's worth fighting for, isn't it? Yes. No, keep fighting.
Thank you so much, Mayor. Thank you so much for being here. We also have members of the federal, representatives of the federal delegation here who were present at the press conference yesterday at Carney Hospital in Dorchester, including Senator Markey's office, and we have Yeji Lee, Regional District Director for Senator Warren, who wants to make a statement. Ms. Lee?
Thank you to everyone in attendance. My name is Yeji Lee, and I serve as a Regional Director for Senator Elizabeth Warren. I am here to share a statement on behalf of the Senator. Good morning. A big thank you to our state and local delegation, our fire chiefs, advocates, our constituents, Council on Aging, and Nashoba Associated Boards of Health for your leadership. We are here in this disaster because CEO Ralph De La Torre and Steward's entire executive team have failed this community. The closure of Nashoba Valley Medical Center is the direct consequence of looting by Steward executives, private equity investors, and corporate landlords at the expense of patients, healthcare workers, and Massachusetts communities. My top priority is protecting patients and frontline healthcare workers at these hospitals. I appreciate everything Governor Healy and her team are doing to address and help limit the damage from the closures of these healthcare centers. I know how hard they are working, and I have confidence in their ability to navigate this challenge. Healthcare is a basic human right. So to CEO Ralph De La Torre and Steward's entire executive team, and to all the private equity investors who think they can gut our healthcare system to make a quick buck, let me be clear. We will do everything in our power to make sure you aren't allowed anywhere near the head of a healthcare facility ever again. Last month, along with Senator Markey, I introduced my Corporate Crimes Against Healthcare Act, which will prevent healthcare executives and private equity investors from harming patients and getting away with it. I have called for investigations into wrongdoing by Steward executives that put our community at risk, and I will continue to work with my state and federal partners to send a clear message to anyone who tries to loot our healthcare system for profit. We will hold you accountable. Steward's closure of Nashoba Valley Medical Center will present challenges for our community. These are our neighbors, our friends, our mamas, our daddies. I understand the urgency and will keep working hard to hold Steward accountable and protect the care our community needs. Thank you.
Thank you so much, Yeji, for being here. We have union leaders who have led the effort to protect the quality of health care both at Nashoba Valley Medical Center and hospitals across the state. And I'm very proud to have a very long-standing, strong partnership with the Mass Nurses Association, going back to organizing a lot of the nurses at Nashoba Valley Medical Center and other hospitals. Representing the M&A, we have one of the lead negotiators for the team, Audra Sprague.
My name is Audra Sprague, and I have proudly served as a registered nurse at Nashoba Valley Medical Center for 17 years. I would like to extend my gratitude to Senator Eldridge for organizing the press conference and all the officials present today to provide their support for the future of our hospital. Today, I stand before you to represent the 490 dedicated employees of Nashoba Valley Medical Center who work tirelessly every day with very little resources in our community to take care of the residents here and in the surrounding towns. I am here to inform all of you of the severe impact of your health and safety should our hospital close. Over the past several months, we at Nashoba, along with other Steward-owned hospitals, have faced an exhausting and distressing ordeal, awaiting decisions that will significantly affect our employees, many of whom have dedicated decades to this facility. Most critically, the fate of thousands of patients, their families, all hang in the balance due to the mismanagement and unchecked greed of Steward Health Care, compounded by this bankruptcy process that has kept us in the dark from the beginning. Community hospitals like Nashoba are often the first and only point of access to essential medical services. They provide critical care for the elderly, respond swiftly to emergencies, and manage chronic medical conditions. The potential closure of Nashoba Valley Medical Center would have devastating consequences on the health of our community, a fact that is impossible to fully convey to everyone in just a few minutes. The closure of this hospital would force residents of the surrounding towns to travel significant distances to access emergency care. During peak travel times, a resident of Pepperell could face a 50-minute drive to Leominster and over an hour to Emerson. Local EMS are not staffed to handle these transfer times, which could exceed round trip 2 hours, depending on traffic and weather conditions. This delay is the absolute difference between life and death in many situations, such as strokes, heart attacks, anaphylactic reactions, and many other emergencies where minutes count. If this hospital is allowed to close, there will come a day when you or your loved one will be in desperate need of an ambulance and left waiting, and you will remember these words. Beyond emergencies, closing Nashoba would mean that patients and families would have to travel for inpatient care, medical appointments, and specialty consultations. Managing a chronic illness and maintaining good health is already challenging if it's right in your community. If you move these out an hour away, it's going to make it nearly impossible. We lack the public transportation, taxi services, and have very few rideshare options to facilitate commutes for these people. Today, we remind Governor Healy of the promises she made to all of us and the residents of the Commonwealth on May 6th, and I quote, "We are here to commit to protecting the patients, workers, all access to care. Having a hospital open somewhere in the state is not access to care. We commit to being open, transparent, and responsive every step of the way and focus our priorities to protect every community that depends on these hospitals." We believed those words when she spoke them. However, since those commitments were made, we have seen no transparency. And worse, we have been given false reassurances. Just 6 days ago, Governor Healy announced that there was qualifying bids for all 8 hospitals. Yep. Then suddenly, last Friday, it was announced that only 6 of the 8 hospitals would remain open, with Nashoba Valley Medical Center and Kearney Hospital set to close in approximately 30 days. We call on Governor Healy, House Speaker Mariano, Senate President Spalika, and our municipal leaders to take immediate action to ensure the continued operation of our hospital. This includes declaring a public emergency to protect Nashoba Valley Medical Center. We also urge our state leaders, including the Attorney General, to enforce the state to require the minimum 120-day notice before the hospital closure, allowing time to find a qualified bidder and to continue these vital services, even if it means seizing this facility by eminent domain. No community is expendable. The Commonwealth has a duty to protect these communities by preserving all hospitals impacted by the crisis. Funding from the state is being provided to ensure that the new owners of the other 6 Steward hospitals can succeed. Yet, due to lack of transparency throughout this process, the employees and patients of Nashoba Valley, whose lives will be forever changed by this closure, have questions we feel we deserve to be answered. Governor Healy, 1, if Nashoba were to obtain a qualified bidder, would the Commonwealth provide any financial support for this institution? Two, why did the 6 other hospitals that are being continued to stay open have infrastructure built in with support from the Commonwealth, but not Nashoba Valley Medical Center? 3, is access to health care less important for the rural community of Nashoba Valley? We are confident that if the Commonwealth were to provide the same financial support to Nashoba that they are giving to the remaining 6 hospitals, we could successfully transition to a new owner. Please help us obtain this support so we can work with a new partner. There is $9 billion in the rainy day fund. It was announced on the news this morning. It doesn't. And today, for everyone that works and receives care at Nashoba Valley Medical Center, it doesn't get rainier than today. You have pledged to ensure that every citizen has access to quality health care, regardless of where we live. We ask you now to stand behind those promises. Thank you.
governor. Did you hear Audrey? We also have a wonderful other proud union partner representing many workers at Nashoba Valley Medical Center. I want to introduce Kim Higgins, the administrative organizer for SEIU 1199.
I want to thank the senators and other elected officials today for the support on care in the community of Nashoba Valley. As Senator mentioned, my name is Kim Higgins. I'm an administrative organizer for 1199 SEIU. 1199 SEIU represents nearly 5,000 members across the system at 8 hospitals in Massachusetts. That includes over 300 members at Nashoba Valley Medical Center, including dietary workers, respiratory therapists, environmental service associates, patient access representatives, lab and pharmacy techs, diagnostic imaging technologists, and many others. A care team comprised of neighbors, friends, and family. Steward Healthcare's decision to close Nashoba Valley Medical Center is devastating. Patients in Ayer and across Massachusetts will now ultimately pay the price of Steward's mismanagement. Over the past 6 months, caregivers have continued to show up even in the face of uncertainty, putting their fears aside as they cared for others. Many have been at Nashoba decades, both starting and ending their careers here. And now, jobs and care will ultimately be pushed out of the community, changing Ayer forever. The healthcare workers of 1199 SEIU urge all stakeholders to establish and implement a transition plan that helps mitigate the reduction of care. Steward's proposed 31st closure date is unrealistic. We call on Steward and its creditors to meet DPH's standard of 120 days notice to ensure a smooth and orderly transition. Caregivers, patients, and residents deserve to be centered during this time. What happens at Nashoba and Kearney is a reminder that the future of care in communities across Massachusetts is at risk. It's time for action to ensure that patients are able to receive care in their communities from caregivers that they know and trust. Thank you.
Thank you so much, Kim. I also want to have a representative of the Nashoba Valley Medical Center. And again, we are hearing from some doctors at the Nashoba Valley Medical Center, some leaders at the Nashoba Valley Medical Center, that there are buyers, legitimate buyers, interested to purchase and save Nashoba Valley Medical Center. And so I want to ask advisory board member and longtime community leader for this area, Melissa Federhoff.
Thank you. I am an advisory board member, but I'm also the president of the Nashoba Valley Chamber, and we've had a great partnership with Nashoba Valley Medical Center forever. And we penned a letter to the governor and to Secretary Walsh, Executive Office of Health and Human Services, and so I'm going to share, in echoing a lot of what has already been said, but I'm going to share that we are deeply concerned about the recent closure of the Nashoba Valley Medical Center, which is a vital healthcare facility in our community. The closure, operated by Steward Healthcare, has had significant impact on our region. Businesses, we represent over 500 businesses from over 17 communities. Businesses and individuals alike rely heavily on the services provided by the Nashoba Valley Medical Center. Its closure not only jeopardizes the health and well-being of our residents, but also poses a substantial threat to the economic vitality of our community. We understand the challenges faced by healthcare providers in maintaining sustainable operations, particularly in the current healthcare landscape. However, we firmly believe that the closure of Nashoba Valley Medical Center will have a far-reaching negative consequence for our region, which extends beyond the realm of healthcare. Therefore, we kindly request that the governor provides aid, assistance, and support in addressing this critical situation. We implore intervention in engaging with Steward Healthcare to explore alternative solutions that will prevent the closure of Nashoba Valley Medical Center. We are so grateful to the leadership at Nashoba Valley Medical Center and the over almost 500 employees that are supporting all of the residents and businesses in our region, and we are happy to be here to help support. Thank you.
Thank you so much, Melissa. I want to thank each and every speaker for being here. I want to thank the incredible turnout today here at Ayer Town Hall. And, I want to close and say, after elected officials and other leaders spoke in Dorchester yesterday at Cardi Hospital about the practices of Steward, is yes, we're here to condemn Steward's financial practices. We're here to condemn their profit over people. But there was a resident of Dorchester who raised the question yesterday, and I want to raise it up today, is that what are we as state officials, what are we as community leaders doing to keep this hospital open? So when I close and say, Governor Healy, what are you doing to keep Nashoba Valley Medical Center open? I want to say to Health and Human Services Secretary Walsh, what are you doing to provide state support to keep health care excellent in this area? I want to Department of Public Health Commissioner Robbie Goldstein, what are you doing to issue a 120-day closure notice for this hospital? All keep fighting, all keep brainstorming, all keep advocating to keep Nashoba Valley Medical Center open. Do you agree with me? Yeah! So what I ask everyone here is keep fighting back, contact Governor Healy to express your support for what we're asking for today, and keep sharing your stories. Email us as elected officials, share your stories on social media, and talk about how important Nashoba Valley Medical Center is to this region, to this community. Thank you for being here. Let's keep fighting.
You've been listening to this large gathering, hundreds of people who turned up in the Ayer Town Hall as Massachusetts lawmakers gathered there this morning, fighting back on Steward Healthcare's plan to close Nashoba Valley Medical Center at the end of August. Now, these lawmakers, Ayer Town officials, employees, and patients are all calling on Governor Maura Healey to enforce a 120-day notice law here in Massachusetts before any medical facility may close. They claim that Steward is prioritizing corporate greed and say employees should be able to keep their jobs and people there in the community should be able to have access to health care close by. Tomorrow, a hearing is scheduled in bankruptcy court. WBZ's Penny Commit is in Ayer, where those lawmakers just spoke. She will have much more on WBZ News at noon, but several of them said closure is simply not an option, and closure would be unacceptable for the people living in and around that area. Be sure to stay with WBZ and CBS News Boston for more on these potential closures.